Thank God, it's another LA day. Saj gets his Eustachian tubes done today.
Hi. Who you bringing? I just need the name. I don't need that from
He
you.
said bring the birth certificate. Okay. Saj Ali, Sajali.
Well, Baptist Church?
Yes.
Okay. They don't really care. I don't even know
Right.
why they make us ask that, but, okay, so the insurance we have is
Surgery day.
all right. There you go. What a big boy.
Is he
Look
smiling?
at that.
Sort of like a sort of kind of smile.
You're so brave.
And then you guys can just have a
The last time I fed him, and it was milk, was around 11:40ish. So my man is hangry. Okay, real hangry. Are you hungry? He hit his head. Of course, he's always getting injured. Can't eat yet. Not time to eat yet. I'm gonna show them eat. I'm gonna show them how to eat. Eat. We can't eat yet. See, guys, he wants to eat. You saying eat. You want to eat. All things considered, man, he's feeling good. I forgot the diapers and wipers downstairs. Felicia's downstairs. She's eating right now because we can't bring it up into the hospital. I feel like, waiting. I think Saj's they're nasty, so we're about to see if they have diapers and wipes. False alarm. Thank God.
When you're talking. Isn't that cool? Isn't that cool? Mom's gonna use. Oh, you did a good job. Mom's gonna be happy about that. No? Okay.
Mom is at valet.
Okay, so I'll send her there.
Thank you.
You're welcome.
Allergies to food, medication, latex, tape, gloves.
No.
Pretty soon, honey. And is he here for frequent ear infections?
He's here for Eustachian too.
Yeah, but
Because of frequent infection.
has he been exposed to anything contagious that you know of?
No.
Immunizations up to date?
Correct.
Mom just wants me to take a picture of you, okay?
Has he ever had anesthesia before?
You gonna smile for Mom?
Would you please?
I hear you. I hear you laughing. All right, so did you take a second to
Usually the pediatricians try all the different medications, so we sort of rely upon them to do everything short of surgery. So if there was something that a pediatrician could have done in the office or something like that. But it's from that recovery area that they'll go over your discharge instructions, and then you'll be sprung out of here so everyone can get breakfast together.
How long is recovery?
About 15, 20 minutes.
Is he going to have any pain today?
Well, they're going to use an injectable form of like Motrin when he's asleep, and then if you still need it, about 6 hours later, you can get another one. But some people do and some people don't. Sometimes they feel better because the pressure that the fluid causes in the middle ear has been released. The fluid gives you that feeling like when you're on an airplane and you're landing and you feel the top of your ear. So relief of that is sometimes so good that actually they're happier.
Okay.
The one thing you might do, and this is good this day after the 4th of July, is you might startle to unexpectedly loud sounds, like dogs barking or vacuum cleaners and stuff. He's will be hearing better than he's gotten used to in the last few weeks since the flu has been there. So don't be surprised if he's a little upset about very loud things until he gets used to the word getting noisier than he's grown accustomed to.
So his hearing is really.
Well, it's done enough that on the audiogram that I expect him to recover about 20 decibels, and I can make him start a little more. Yeah. And hopefully, it'll be also reflected in his as he's getting old enough, his ability to hear speech sounds and stuff. We'll go on from there. Okay, but we'll see how much it happens when we see you back in your office in about 6 weeks. Okay.
Okay, thank you.
I'll let Dr. Morales talk to you. We'll talk more afterwards.
Anesthesia.
Hello.
I really like that guy gave me you. I can't really explain it. I'm so into you. You like that? Sing it. I really like that guy gave me you. I can't really explain it. I am so. Oh, thank you. Thank you. Thank you. Thank you. I really like that God gave me you. I can't really explain it. I am so. Okay, thank you. Thank you. Hello? Hello? It's for you. Say hello. Hello? 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 Thank you.
Alicia Christina Williams. What? Oh, maiden name of mother.
Hey, we don't know what Williams do.
I was like, what? Like your mom.
Yes, it is. People want to know what to.
You eat Oh, he's been hitting me all day too. Saying he's hangry. You're hungry and angry. You're not eating, so I'm not eating. Come on, smile.
Oh no. And we forgot the bottle.
What bottle?
I told you.
Oh, yes. So you can eat right after.
He's gonna be like, still no food.
Where is it?
We're gonna get you some apple juice. Want some apple juice?
Yeah, let's make it an apple juice day.
Apple juice. He look like Sai when he do that.
All right.
Do it again.
All right, so we're doing bilateral tubes.
Yes.
And so spelling is correct on this label. All right. So let's just get this over with, right?
Yes.
So it'll be easier to move around.
Do you think we could can we get a new sheet on here? Everybody's kind of been leaning and
Sure.
lots.
Why don't I do this? I'll take this to the room. I'll come back and get him, and then I'll grab a sheet while he's having a surgery, so that I don't waste time for you guys. Okay?
Oh, he doesn't want to go?
He's holding so tight.
You know it's about to happen.
Not your dad?
We wanted y'all to see Saj walking away, but that didn't happen. Felicia did a oop-de-doop.
Did I?
On the
Or
phone.
did you just leave
Yes.
it recording, but you never do? You always press stop.
No, I pressed stop.
So I pressed record.
That's crazy. But I told you that my phone it turns off a lot.
But we have pictures.
Yes. That was him. That was him. Prayer over the anesthesiologist's hands, Dr. Poje's hands, so that Saj has a clear 100% success rate in this surgery, that there are no underlying issues from this simple surgery, but that the diagnosis is solved and that's it. God, we thank you for him coming out healed. In Jesus' name, amen. That's why I'm thinking that Saj will cry. Because he's hungry.
He's not gonna cry. He's gonna cry, but he's gonna whimper.
He's gonna cry.
He's not gonna cry for long.
Maybe not for long, but he's going to cry.
You'll see.
Is it yes or no? Is he going to cry or no?
No,
Stay
don't change your
committed to
answer.
something.
No.
Is he going to cry or no?
The doctor, and you'll
I
see it on the
said
footage.
Saj is going to cry. Felicia's saying Saj is what?
He's going to whimper. And then he'll be fine.
Cue definition of whimper versus cry because I have no idea. Okay, now that that's up, I'm saying that he's going to cry. You say he's going to whimper.
For a second.
Okay, so we'll see. I'm still sick, y'all, so I can't hold up this not even a camera. It's a camera phone. I can't even. Whew. But we were talking about something else. You talked about him being under anesthesia.
Right.
And you being concerned, I thought, too.
I'm always concerned when you die temporarily. Are you coming back or no? And because Saj has anything random that can happen, happens to Saj.
Right, that's true.
So that's why last night I just couldn't sleep. Because I'm like, he's looking out the window, the light is glimmering on him. I'm like, is this my last time seeing my child, Lord? Because really, you really let a lot happen to him.
Right. Is that it?
It goes on right here.
Gotcha, okay.
Really thick, gooey fluid both ears, so it really wouldn't surprise me if he does startle to loud sounds. It's almost good that this is going after the 4th of July. This isn't a deal with the fireworks at full sound. But like dogs barking or like vacuum cleaners might upset him until he gets used to the fact that the world is a bit noisier than he's grown accustomed to. At any rate, you'll have a prescription for drops that we send to your pharmacy.
Okay.
The drops go down the ear canal, and you pump on it like that.
Okay.
About 7 or 8 times. The purpose of the drop, well, actually they have antibiotic and anti-inflammatory properties, all of which are nice, but you're really using it almost as a detergent to prevent the fluid, the gooey fluid, from drying up in the center of the tube and where it could form a crust that could plug it. So you'll do that once tonight and then twice a day for 3 days.
Once at night and twice during...
Once tonight,
once
because he
tonight.
got his first dose just now, and then twice a day for 3 days. So Monday night will be your last dose. Save the bottle. They're useful if you were to get a draining ear for whatever reason. Anytime this summer, at least until the expiration date of the drops you paid for, you might as well keep them.
Right.
And when we see you back in the office, we'll recheck his hearing and make sure the tubes are functioning well.
Should we expect to see any drainage, any blood?
When you're putting drops in, stuff will come out. And that's, like I just said, the purpose of the drops is to wash away that stuff. So, but when you stop the drops after Monday night, all drainage should stop within a couple of days. So if the ears are still draining, let's say toward the end of the week, like say Thursday or Friday, give our office a call. We should try it by then. But yes, it'll be draining when you're putting them in because you've got to go somewhere, and what goes in has to come out.
Right.
And so what about water, swimming pools?
Well, regular water is not an issue unless the ear is 3 feet deeper. So, I mean, at his age, it's unlikely.
Right.
So if he's not floaty or in one of those little baby pools, even if his head accidentally goes under, you don't have to worry about it. Where you do have to worry is in the bath or shower. So when you're at the drugstore, and they're rather easy to find this time of year because it's swimming season, they sell these earplugs. They're moldable, reusable, one-size-fits-all deals. So you use them when he washes hair. You'll find out that children hate earplugs. So the only time you really need them is when you do the hair and rinse. So the rest of the bath time, let him win, let him have his way.
Okay.
And you don't need the plugs for like when you're washing the rest of them, he's just playing in the bath water or anything like that.
And how long do you think he'll keep the earplugs in?
The ear tubes, you mean?
I'm sorry, the ear tubes.
They average a year, but the bell curve is relatively wide, so it's anywhere between 9 and about 18 months. But the good news about having them put in this time is you're almost guaranteed a full winter.
Right.
And that's when they're really in their keep. Although, like I say, here it is in July and his ears were chock full of stuff. So,
What does that mean?
well, summer is usually the quiet time of the year for ears, so he's already in a situation where a lot of people would have had their ears clear up already. So when they fall out, we'll just have to take a look to see if fluid comes back or not. He will be a year older, so maybe not.
Right.
I mean, everyone who has ear tubes when they're younger eventually gets to the point where the fluid doesn't recur every time they catch a cold or anything like that. So hopefully when they fall out, we'll check. We're responsible for the tubes, so we're going to be checking on them every 4 months until they fall out and his ears are healthy. So we'll see you in August, and we'll see you around Christmas time, and then we'll see you in the spring. So that's what we usually do.
Okay.
Okay?
Have you ever seen a case where someone needs to wear them for like 5 or 6 years?
Oh yeah. Unfortunately, you don't know who they are until they get there.
Right.
Right? Every adult's running around with an ear tube, and there are few. Were once children who had them.
Right.
And their parents had the same conversation with us. So, you can't tell. There are certain conditions where that chance is higher. People born with Down syndrome, for example, people who have cleft palates, more likely to need ear tubes until they're older. But there are people who don't have any other medical risk factors who still have issues with the ears. But I think it's premature with the first set to be worrying about people needing a second or a third set or whatever. I mean, 90% of the people who get a first set get exactly one. So,
Okay, thank you.
yeah, it's always good to be hopeful rather than be pessimistic.
Yes, sir.
Okay?
Thank you for
So
everything.
that's coming to get you shortly, and like I said, I think we have a follow-up appointment already in the
We do.
computer. So
Yes.
we'll see, and it would definitely be interesting to see if he, and watch over the next few days, how he responds to loud sounds.
He's on his way to recovery. That's why they said hope they'll be to get us in a minute. It's done.
The surgery's done?
The surgery's done. Yes.
Yes. Jeez Louise. You don't know. How can you? Thank you.
You're welcome.
No pictures. No
Okay.
pictures.
Okay. Just gonna keep him in the car.
What's going on with you? Oh, hey guys. Oh, hey.
Thank God. It's another Ali day.